Hi everyone, my name is Abir Amirdash and I am a geriatric and acute care nurse practitioner. I'm also a cannabis medical provider. I certify patients on the island of Hawaii. I've been doing so since 2017, and I also educate my patients and teach them about how to use cannabis. I also work with a lot of pain clinics, I get referrals from oncologists as well. My background also is oncology as well. So I love uh, talking story with Kapuna, and I also love cannabis, and it just brought both together. Just want to say I don't have any financial ties or anything. I love presenting about cannabis and geriatrics, so I hope you folks enjoy. Um, just a little bit of statistics when, you know, cannabis use has been increasing among uh, Americans. About 47% of Americans say that they have used cannabis actually at least once in their lifetime within the last 2 years. Especially during COVID and all that statistics had gone up. As of 2022, almost 21% of people over the age of 50 use cannabis or have said that they've used cannabis, and about 8.4 adults age 65 and older report using cannabis. And just 2 years ago, that number was just 4%. So it almost doubled. There is continued increase in use of cannabis. And with that, increase in using cannabis, we always think of cannabis as a benign medicine. It is. It has a pretty safe therapeutic index, meaning it doesn't, nobody's died from cannabis that we know of, and it is intoxicating, but it doesn't. The side effects are limited compared to other prescription medicines. But with that said, there are risks involved with using it in the elderly, just because as we age, our body system processes things differently. That's actually in general medicine. There's a Beer's List criteria that we follow for prescribing medicines for people over the age of 65, and there's a bunch of medicines that we're not supposed to prescribe for people over the age of 65 because of the worsening side effects and worsening outcomes. But unfortunately, some of these meds continue to be prescribed, and that list gets ignored. Just to review a little bit about how cannabis affects your body and what is cannabis. Every mammal has what we call an endocannabinoid system. And what an endocannabinoid system is, it's a group of receptors, group of enzymes, and that your body secretes, and it's also found in cannabis. It's called phytocannabinoids. Your own cannabinoids, what your body makes, is called endogenous cannabinoids. And there's two that we know of that your body secretes. But what does the endocannabinoid system do? It actually involves every aspect of your life. It involves your memory, it involves your sleep, it involves your appetite, it involves regulation of your hormones, regulations of nerve, regulation of pain. It involves everything. That's why cannabis affects so many different aspects of that. And then there are phytocannabinoids, which are chemical components that mimic those cannabinoids that are produced by our body. And they're called phytocannabinoids. And so far, we've identified about 100, 120 different cannabinoids. What we know of, the most one that most people know of is THC, or tetrahydrocannabinol. That's the one that makes you feel high or intoxicated. And the other one that you hear about is CBD, and there's now a growing market for another one called CBG. Those are just different phytocannabinoids, chemical components of the plant that produce a therapeutic effect, alongside with something else called terpenes. Terpenes is, think of them as like the essential oils of any plant. If you've had ginger as a drink, you've just used the therapeutic effects of the terpenes of ginger. So the same concept applies when it comes to cannabis, and it's the combination of the cannabinoids and the terpene effect is what produces what we call the entourage effect in medicine, and that produces that holistic effect that you get with cannabis. Versus they tried in the 80s to synthesize THC actually as a pill, but it wasn't successful in producing a lot of what just regular organic THC produced from a plant did. But it's still found on the market and it's just used as a band-aid in cancer patients. But actually, uh, the Cancer Society actually recommends using cannabis. If you go to their cancer.org, they recommend using cannabis to help with side effects of chemotherapy. But there are, like I said, a lot of different cannabinoids, and now it's a little bit difficult to, understand what's on the market. Or you go to the dispensary and they tell you there's CBD and there's CBG and there's THC, and you're like, I just want to treat my pain, or I just want to treat my ailments. So how to decipher all that? Just to kind of put it simply, THC is what's found in cannabis, and that's what's federally uh, still illegal, unfortunately, and that's why you get the card, to be able to have access to that THC product. So anytime you see THC, is anything from the dispensary. Now you'll see also on the market THCA. Basically, THCA is actually THC. It's actual weed. When you have THCA is just weed in its raw form. If you have flower, if you harvest the cannabis flower, that's THCA. And when you apply heat to it, you're decarboxylizing it. It becomes THC, the active component of cannabis. But if you see THCA, it means it's weed. But the government doesn't know the difference between that. That's why there's the gray market. But CBD or cannabidiol is, as you've heard of it, it's been on the market for the last 10 years, and it's been marketed as the miracle drug. But we know it isn't. It's one of the other cannabinoids that works really well on inflammation, and I'm going to touch on that a little bit later. But it works well on reducing inflammation in the body. It works on different receptors, and it helps reduce pain that way by reducing inflammation. And because of that pathway that it uses, actually they're finding uses for it in reducing glycemic index in diabetes, and also reducing blood pressure. And I'll touch on that a little bit. The only intoxicating one that causes us to feel intoxicated or have psychoactivity is THC. CBD does not, or CBG does not. And none of those cannabinoids are actually, you can buy those over the counter. None of those are regulated. And there's lots of products that you'll find on the market. They're not FDA regulated, unfortunately. So you have to be mindful of what brand you get, and make sure that someone tests their products to tell you that it does exactly have what it has in it and all that. And we have some wonderful brands here in Hawaii, locally grown as well. But CBD really, a lot of Kapuna patients like using it, or people who are not used to using THC, and when they're still starting to be introduced to THC, CBD is a recommendation to use because it helps ease some of the side effects that accompanies with THC. But CBD, like I said, you can use it to help with pain, and you can take it over the counter. It doesn't cause intoxication. CBG or cannabidiol is another cannabinoid, and this one is actually serves both. It serves a role as a terpene and a cannabinoid, so it's both. And it's very versatile. It's actually the mother of all cannabinoids. It's where THC comes from, or CBG. So you find it in young weed plants. But now they found a way to be able to make actual grow CBG weed, and it's being used in a lot of research studies and all that, and it does help with reducing inflammation as well. And this just shows you the endocannabinoid system. Like I said, it has different receptors and different enzymes that break down some of those receptors. But usually there's two different receptors that you hear about when you talk about, two different receptors when you talk about the endocannabinoid system: CB1 receptors and CB2 receptors. CB1 receptors are mainly found in the brain and the nervous system, and that's what THC usually works on. And it usually affects, that's why it affects movement, it affects pain, it's mainly found in your brain. Versus CB2 receptors, CBD kind of works on those receptors, not directly, but kind of indirectly. And CBD can also work on CB1 receptors. People who take too much THC actually and they're intoxicated or having side effects from THC, one of the things is I recommend for people is to use CBD drops because it helps kick off that extra THC off of that receptor. So, so all new patients that are new to cannabis, I always recommend including some CBD in there to avoid the side effects. And what's available here in Hawaii, the methods of how you can use cannabis in Hawaii, it's we're limited to 3 different methods, but those are the main methods mainly that are found. We have inhaled methods, we have oral methods, and we have topicals. Inhaled methods meaning anything you smoke. And depending on how you use it, the onset and the duration is different, meaning how long it takes for it to work and how long it lasts in your body. Anytime you smoke anything, whether it's smoking flower, whether it's a bong, I'll talk a little bit about vape cartridges or any of the concentrates. Any inhaled methods is one of the fastest ways to get cannabis into your body. So it works within minutes. The onset is usually about 5 to 6 minutes, and it lasts 2 to 4 hours. It depends on actually an hour to 4 hours. It depends on consumption, and it also depends on topics, how often the person uses it. And but this one is the recommended method for people who need immediate or relief for acute symptoms. So it's one of the fastest methods that you can get cannabis in your body. And usually the absorption, the studies that show like how much your body absorbs whenever you smoke, it usually is between 10 to 24%. It's still considered low, but it's the most guaranteed method to get cannabis and THC into your body. But not everyone smokes, and there are also I've also heard with people talking about I'm asthmatic, I can't smoke and all that. Actually, a colleague of mine who's a pulmonary doctor, it's actually cannabis, THC is a muscle relaxant, as long as you're not mixing it with any tobacco or anything. If you are a smoker, it actually is not gonna. And studies that were done with long-term smokers actually, there was a study that they compared long-term use of cannabis compared to people who smoked actual tobacco, and to this date, there's no data that shows that smoking cannabis by itself produces emphysema, which is the hallmark of smoking. But if tobacco does with that, and there were no inflammatory changes for people who smoked cannabis compared to people who smoked tobacco. But just going back to smoking, so smoking works fast. There's a prevalence in the industry of using vape cartridges or vape carts because they're easy to use, and unfortunately they're being promoted as medicinal. The truth is there's really nothing medicinal about those. They do always have solvents. They always, your weed is not liquid, right? Cannabis is not liquid. To make it into liquid is being processed. And the other thing is they're usually concentrated, so I don't recommend those for people newly used because it's too much, even with the small puff or any of that. But I understand that they are convenient for some people. If you are someone who uses them, don't make it your main method of use. They carry a lot of side effects. The risks don't, outweigh the benefits. Oral methods, anything you take orally. Whether you put it on your tongue or you swallow it or anything, it can take anywhere between 30 minutes to 2 hours to work. And it's the preferred method for kind of like maintenance therapy, meaning if you are someone who has a chronic pain or a chronic condition and you utilize cannabis, edibles would be your route. And because whenever you take edibles, they don't work almost immediately. They take anywhere between 30 minutes to 2 hours. It all depends on the formulation they're made in or how they're made. So it's always good to start slow and low and never repeat your doses before waiting 2 hours for that. And it's always, cannabis is lipophilic, meaning it likes to attach itself to lipids. So taking cannabis edibles with food is actually, you absorb a little bit more. Although the bioavailability for oral cannabis is pretty low, I think it's 4 to 12%. It's pretty low. But that's why some of my patients that I talk to, some of them will tell me edibles don't work for me, even if they've gotten up on their dosages and titrated that. And there's a group of people that edibles does not work for them, so you have to resort to other methods as well. Uh, and last method that's available here in Hawaii is topicals. Topicals meaning any creams, any salves. And the benefit of those is that they also work almost immediately. They don't cause any intoxication, and they usually last 2 to 3 hours. So you could use those by themselves, or you could use them in combination with the other methods, whether you're using edibles or topicals, or you can use, as long as you're mindful of your dose, you can use a combination of all three. When it comes to cannabis, there's not a set dose or a set. Everyone is different because we are all unique within our endocannabinoid system and in our metabolism. I've had patients who weigh less than 100 pounds and in their 80s, and they use 100 to 200 milligrams of THC. And I know guys who are 6'3" and they take 5 milligrams and it knocks them out. So it's not about weight, it's really about your endocannabinoid system and how often you use it and your exposure to it. I think it was about cannabis and neurological disorders. So I wanted to talk about actually using research about using cannabis with Alzheimer's disease, using cannabis with Parkinson's disease, and using cannabis with ALS. So if you remember going back that I said that cannabis can help with reducing inflammation, and just to go back a little bit, the research that we know of, THC, CBD, and CBG, they all reduce inflammation, but THC was found to be the least of all those cannabinoids. CBD and CBG does a better job than those. And when it comes to Alzheimer's or Parkinson's, there's the evolving research tells us that we have it's due to buildup of amyloid beta in the brain, and that usually happens when you sleep. Your brain, there's your glial cells. They're your janitors of your brain. They clean all that. So sleep is important, but they found that actually patients who are consuming cannabinoids, THC, CBD. THC and CBD is the research that I've read, that they both actually reduced reduction in formation of beta amyloid in the brain, and it also helps with sleep, restoring sleep at the same time. With Parkinson's, even though there wasn't really compelling research when it came to Parkinson about it stopping curing the disease, but it did show with Parkinson's that there was no increase on the medication dosing. It was compared to people who weren't using cannabis, and there was better symptom management when it comes to rigidity, muscle rigidity, and sleep, and anxiety, reduction in anxiety. Oh, because I think I lost. Sorry, I'm just gonna do it here. So I'm gonna do it here because I think he took the phone. So with Parkinson's, like I said, it reduces tremors and muscle rigidity. And CBD, I'll talk a little bit about it, how it offers some neuroprotective value to it, because CBD actually helps with reducing neuroinflammation in the brain that causes buildup of plaque and all that. So another thing CBD is helps calm the nervous system, because it works on one of the other transmitters, which is GABA, which also is helps calm the nervous system. So people who have tremors or Parkinson, it's also advisable to do a combination of both THC and CBD as well. And it's also there's a trial being in the UK called the Libby trial that's currently being done with dementia patients who are on palliative therapy. That cannabis is being used as a palliative medicine rather than using medicines like psychotic medicines and stuff. Because uh, I work with a lot of dementia patients, and unfortunately one of the first line therapy that if someone with dementia is having is to prescribe them one of the antipsychotic medicines called Seroquel. Uh, it is, I've seen the benefit of it in some patients, but also I've seen how a lot of patients cannot tolerate it, and sometimes it causes worsening agitation. I'm lucky to have worked here on the island also, and been able to help family members with patients who have dementia, and like working with dosing, and they had a better quality of life than using pharmaceuticals with that. Um, and it also, with multiple sclerosis, it helps reduce the muscle spasms associated with multiple sclerosis. And also, there's some emerging study with ALS that with using CBD and THC together, it can actually help halt the disease progression as well. But a lot of the research when it comes to cannabis is very limited, or it's privately funded because of the federal regulations. As we all know, cannabis is used for pain management as well. It works really great for management of chronic pain because it does a wonderful job in reducing pain, reducing inflammation, and helping with sleep with that. And there's been studies done with, there's a systemic review study that they reviewed. It was a pretty intense study. They reviewed, I think, 4,000 different studies. And out of those studies, they were able to bring about 26 studies that were really high quality studies, and they reviewed how patients who had rheumatoid arthritis, osteoarthritis, and there was another type of arthritis, and it was people who took THC, people who took CBD, CBG together, and people who took a combination of all three. And what the study showed is that people who took the THC by itself did have a reduction in pain, but not in inflammatory markers. One of the things they also followed inflammatory markers. Versus people who did CBD, CBG, they had a reduction in inflammatory markers, but their pain took a little bit longer to be reduced, about I think 3 days to a week. Versus people who took a combination of all three had the reduction in all of their symptoms and pain, better mobility, and reduction in inflammatory markers. A lot of those studies are actually being done in human, but there's still variability of the dosing. So what I tell my patients, always start with the lowest dose that works best for you. It also, it's an opioid alternatives. I've personally worked with patients that we were able to completely get them, along with their pain doctor, to either completely get them off of their opioid with the use of cannabis and other cannabinoids, or they've had a significant reduction in the disease, in their dosing as well. Because as we know, we have an opioid endemic right now, and as you know, honestly, every time I have to write a prescription for a narcotic, it's just like you're scrutinized on, and it's just not right for the patients as well. But we don't have, this is a better alternative, but we still have so many obstacles around it. And it's always when it comes to THC, it's always to avoid side effects. It's always start slow and low, and start lower dose what works best for you, because you could always take more. How does cannabis, whenever you consume cannabis, how does it in general, how does it affect our bodies? Anytime you consume cannabis, it actually lowers your blood pressure. It's a muscle relaxant. It relaxes your vessels, so it lowers your blood pressure. There's actually a study being done right now with CBD to use it as an antihypertensive actually, because it's being done with the NIH. But because THC it decreases your heart rate and your sorry, because THC lowers your blood pressure, your heart rate usually compensates. So your heart rate will sometimes you'll feel it beat faster, and you see that with people who are new to cannabis sometimes, or if someone has used cannabis or it's just a different strain or they've taken too much. Usually THC is the culprit that causes that. So always starting at lower dosages is better, is advised. Uh, it also affects our digestive system as it can either stimulate your appetite or it can curb your appetite. It actually depends on whatever cannabinoid are available in it and terpenes as well. But it helps a lot with nausea, with vomiting, stimulating appetite. So it's if someone's struggling with with their appetite, it's a great medicine. It's actually used with dementia patients that's another reason that it's used besides agitation, it's used to stimulate because sometimes people forget to eat and you're just gonna make them feel hungry. On the immune system, it does because, like I said, cannabis is an immunomodulator. So the way it works is whenever you consume THC or other cannabinoids that, like CBD and CBD, goes and works on that endocannabinoid system, and CBD in general helps reduce inflammation through different pathways, not just one pathway specifically, but it does help reduce it. But they found that also chronic users who use THC excessively, it can actually cause their immune system to be suppressed, the opposite. So it's always good for people, if you are a chronic user and you use cannabis, to pay attention to your usage and on days that you're feeling. If you can, take a tolerance break, but for some people who have chronic pain and they can't take that tolerance break and all that, just use other cannabinoids to just try to reduce your dosages if you notice an increase. And effects on the respiratory system, even though yes, cannabis can help us with reducing pain, and its inhaled methods is one of the most ways that most people use it, but it's still our lungs are not meant to get anything in them. They're not meant to have smoke in them. But it's also, besides that it does give you one of the fastest therapeutic effect, I think it's also a social thing that people enjoy as well. So I'm not gonna tell you, still, it's okay to smoke, from my perspective, but just be mindful that it is not the best method to use it. And if you are to use it, please avoid those vape cartridges. The best method actually to use for inhaled methods is actually dry herb vaporizers, which are basically devices that are found on the market, and you're just kind of like using the cannabis flower itself, and you're just heating it. You're not combusting it, you're not burning it, so you're actually activating the terpenes. And THC actually has a low temperature. I think it's at 230. I make cannabis at home, edibles. So I usually have to decarboxylize it. It's usually 230 degrees Fahrenheit. It's not really high. So whenever you're actually combusting it, it's usually 400, 500 degrees. So you're still using cannabis, but you're burning all the therapeutic effect of it. And risks whenever you're using cannabis. Of course, when you're using cannabis, you're gonna have some impairment when you're using it. But in the past, there's been studies that were done that used to say, oh, if you smoke too much weed, it makes you stupid and it makes you, lazy and all that. Actually, none of those studies were correct. And I tried to dig and find a study for long-term memory about cannabis, and I couldn't find anything past 2009. Because since after that's when a lot of the studies started coming out about the neuroprotective capabilities of THC and how it reduces neuroinflammation and all that stuff. But whenever you're using cannabis, of course, it can cause impairment. So you just have to be mindful. So don't go signing contracts, smoking weed and signing contracts or having important conversations with that. Like I said, long-term effects, there's nothing really that we see now that says don't use it. Uh, Drug interactions is a big one, especially for people who take edibles. Whenever you take edibles, it's just metabolized differently in your body. Just kind of shortly, just whenever you eat anything, it goes into your stomach, mixes with your stomach juices, gets kind of like reduced a little bit, and then goes into your small intestines. That's where the magic happens. It goes through your liver. That's nutrients get pulled out. Whenever you consume edibles, they go through the same route, and once they hit your liver, that's when your liver starts working. That's why it takes almost 30 minutes to 2 hours. Everyone is different. And another thing, if you take cannabis with food, you absorb more, but it takes longer to work. But if you take it without food, it works faster, but you absorb less. Just a little fun fact. So always take it with food. And if you are taking it for like a chronic condition, like I said, I recommend doing it at nighttime for sleep because of the prolonged effect of that. But with drug interactions, it's important just because how it's metabolized in your body and stuff, because your liver metabolizes a lot of those medicines and they go through that. Most of the medicines don't interact with cannabis with the exception of a couple. Like people who are on certain blood thinners, and it's really just one blood thinner from my experience. Anyone on warfarin. Warfarin is an old blood thinner medicine we don't use it anymore, but it can cause, that requires to monitor the levels. It can interact with that medicine. And certain blood pressure medicines, it can interact with them. But I also tell patients who do take blood pressure medicines to follow up with their PCP as well, because once people start using cannabis, they'll notice their blood pressure is starting to get lower and lower. And some people, it also makes them more mindful of their diet and they eat better. So they'll start getting dizzy and stuff when they take their medicine. So I always tell them, check with your doctor and follow up to make sure you don't need a reduction of your blood pressure medicines. So just be mindful of that. And of course, it does cause, because it affects, like when THC works centrally on the brain, so it affects our mobility as well. So you start, I say you become lean, you start leaning on everything. So just be mindful that it can cause a little bit of dizziness. If it's causing a lot of dizziness, that's something else. That's either your blood pressure, like I said, blood pressure medicine, or you're dehydrated. So if you smoke weed or use cannabis edibles and you feel your heart rate is going faster or anything like that, that is, you're, like I said, dehydrated. So be mindful of that. But also people who are on heart medicines, who take heart medicines and stuff like that, who are also on limited water intake, they have to be also mindful of the dose of how much they take. One thing I didn't put here also is people who have arrhythmias, especially something called atrial fibrillation. It's irregular heartbeat. Sometimes cannabis can trigger that. So if that happens, it's the best thing is to abstain from cannabis until, but if it's continuously happen, follow up with your PCP. I'm one of the clinicians that will always check to make sure there's no drug interactions happening with my patients, and I always check to make sure that my patients, I get a full medical history from them. But that's all I have to say. I know a lot of research stuff. If you have any questions, please feel free, but always ask your doctor about it. I'm just going to tell you something. A lot of people don't tell their PCPs that they're using cannabis. I do recommend you do so, especially if you take a lot of meds. That stigma, I think, is going away. And if your healthcare provider tells you is against you using cannabis, go see someone else. Because at this time, any medical professional who tells me cannabis has no benefits is more of a personal thing, and they're not reading the research that's out there. So it's always important. Talk to your PCP. Believe it. A lot of them, even people in the VA, they're more open to them. You have take dominion over your body, what you want. Go ahead.
I'm sorry. Amazing presentation.
Oh,
Such
thank
great
you.
information.
Thank you.
This is in regards to dosing, because I know that everyone has a unique endocannabinoid system. And when I hear the words start low, go slow, I think in my brain, I question that, right? And I know that they've done research on, FDA approved. They're usually synthetic, so they're very different from what we find in the dispensary system or our home grow or our caregiver. But they have established at 2.5 milligrams. And again, I don't know if you can answer that question, but when I hear start low, go slow, is that maybe a place that you could start?
So it all depends. Like what I tell my patients, I always ask their history of what they've used cannabis, have they used in the last 2 weeks, month, whatever that is. And if someone is fairly novice to cannabis, I think 2.5. I usually recommend between 1 to 2.5 milligrams. And if someone they tell me like I'm pretty sensitive to Benadryl or whatever, I even tell them to start with 1 because it's better. You can always take more than take too much and it just And I've had a lot of my patients who come and I always ask, have you tried edibles? And they're like, oh no, I don't want to try edibles. I had a bad experience. And I was like, well, how much did you take? And they're like, well, I took 10 milligrams for my first dose. I was like, well, that's why. So, you're welcome. Anyone else has any questions? Go ahead.
I'm a novice. So when they talk about sativa versus indica, like those two.
So that's a favorite topic of mine. So
Oh,
that's
okay.
really nothing but marketing gimmick. Sativa and indica really just explain how a plant grows botanically. And this is, I'm not joking, this is from growers that I know that I ask them, how do you classify if something is indica or sativa, kind of like just out there? And they said, we just eyeball it and say, oh, this is 30%, this is 70%. I'm not joking, this is what I was told. But the effect that comes from every strain is not really sativa related to like if it's sativa or indica or hybrid. It's all because of the cannabinoid profile and the terpene profile. And there are certain terpenes that are associated more with a more sleepy time effect, more downer effect, like myrcene in high dosages is one of the terpenes that you can find in a lot of the indica plants. So people generalize, indica makes you sleepy or sativa makes you, but really it's not that, and everyone is different. I know people that they smoke the indicas and they go run marathons, and they smoke sativas and go to sleep. But it is something that, because it's a marketing gimmick and it's just become so easy for the language, it becomes that. But I think the dispensaries also are going, like that marketing is kind of like dying off because people are more informed now about terpenes, and you'll see like the dispensaries will list these terpenes. But in general, if you are looking for an effect, I always tell you, ask the dispensary or your bud tender, because the cannabis here, the way it works, the medical cannabis program here in Hawaii, dispensaries have to do seed to sale. So they grow, process, and sell. So they know their products pretty well. So I always tell my patients, for the effect, always ask your bud tender. Just tell them, hey, I want to treat, sleep and pain, and I want to use this at night time. They will guide you within their products. Kind of like going to Longs and telling them, I want the allergy medicine, the drowsy versus the non-drowsy. That's, Anyone with, go ahead.
I have a kind of complex question here on the CBD and CBG, 1-to-1 mix with the THC or 3-to-1, whatever. And then the prices of CBD by itself are so expensive. So say, for example, I had a shoulder surgery and I need cream. it's like bottle freeze is $18, but if I go CBD, it's like $30. Is that anything that can be addressed to?
So CBD by itself as a topical can work for some patients, but it's usually if you get something that's a combination of THC and CBD in it, you have more of a better uh, better response. And usually topicals work locally, so they don't, they work at that area, and they work really well for muscular pain. It actually THC works really well also for rashes and psoriasis and psoriatic lesions, because THC works really well for the skin too, so it helps reduce pain better than CBD. But if you are to use like a topical and you have a card, I would say go to the dispensary and get something that is a combination rather than just CBD. And unfortunately, because the CBD or the cannabinoid market is not regulated, people, you'll see someone selling a CBD cream for $30 and you go to Ala Moana and it's being sold for $200. So that's why I tell people, check your brands and always buy local. There's wonderful brands out here, I encourage you to go check them out, the CBD companies. Go ahead.
And if you're a card holder and you'd like to grow a plant that has equal amount of CBD and THC, where would you get the plants?
So here in Hawaii, you cannot buy plants, but you can buy seeds. And you can buy seeds. Ask any of the seed banks out there. Unfortunately, the most dominant what I've seen is just THC dominant, but you can purchase, some strains that have THC, CBD, like ratios, and I've even seen CBD, CBG, and THC as well. Some of the dispensaries here, when I look at their profiles as well, I do see that they will have a little bit, it's very minute amounts, usually less than 2%. But one of the dispensaries here, I think it's called Cure Oahu, they do have a strain. I was looking at it for one of my patients that is more THC, sorry. There's more CBD and low THC. So but seeds I would check, with any local seed banks if they have any CBD dominant strains.
I'm sorry, I remember the second question was about the delivery methods and understanding and having to go through the process to find out what works for you. And you scared me off vape now, but that's a quick fix for pain. But the solvents and stuff.
If you use inhaled methods, you can just use regular flour or any other methods. But you can also for chronic pain, you can treat with edibles as well. But it's just trying to figure out your dosing, what works best for you.
Right, and then that's kind of what I did. But the vape was effective.
Because it works fast.
Right.
Yeah.
But again, trying to figure it out, sublinguals work pretty well too.
Got it.
So,
It's like that. That's the beauty of cannabis that I like. It's just like everyone is different. Everyone sometimes some method works better than others for others, and some method just some people use differently. But it's always an individualized therapy. It's always just just listening to your body and see what works best for you.
So today was my first time learning that, not to say sativa and indica don't matter, but that it's not how I thought it was, I guess.
Yeah.
So since terpenes is such a big thing to test for dispensaries, would you find it beneficial for the dispensaries to continue that in their testing? Because there might be certain ones that are going to stop doing it, thinking it's not doing anything for them selling product.
I honestly, I think it's beneficial, but I also I tell my patients not to stress too much about, the details or like, oh, it doesn't have CBG and it's not gonna work for me. I always tell them also see what works best for you. There's a lot of what do you call them? Cannabis like strain banks and stuff like that where you can look up, like Leafly is a great resource. You can actually look up strains, because I remember when the dispensaries first opened, like they didn't list any of that stuff. So I would go, and I would be like, what is, for instance, I think they had Yeti or something. I'm like, I've never heard of it. So I would look it up on Leafly and it would tell me what were the dominant cannabinoids kind of thing. It just gives you general. So there are other resources, even if the dispensaries don't test. I think there's a lot of focus on the testing, that people like get so consumed by it. But I also tell people just go with your nose. That's another tip I teach my patients, is your nose knows. So go with what smells good for you, because think of it as food, right? If you smell food that's appetizing, you'd want to eat it, right? So the same thing with weed. If you're a smoker and that's the method that you utilize and it smells good to you, that means it's going to work well on your body. If it doesn't smell enticing to you, maybe don't try it. Any other questions or go?
I'm just concerned about our Kapunas in our assisted living and nursing homes. I'm a member of the ACNA, which is American Cannabis Nursing Association.
Same.
And I've been a nurse for 50 plus years.
Thank you.
And as we know, when they go into assisted living, what's the education for the communities there? I know that they're in New York City, they do have one nursing home, assisted living, that does have a nurse that does actually dispense the cannabis, which whatever form they're using. What do we do? How's it working?
So here, because I used to have my own geriatrics practice, and I would actually go to different ALFs and stuff. Unfortunately, because a lot of the facilities are still funded with CMS, which is Medicare and Medicaid, they get payments through them. So they don't participate in anything that's considered federally illegal because they risk losing reimbursement. But there are some advocacy groups. I've actually, there's a prevalence of care homes here in Hawaii. And care homes, for anyone who doesn't know, it's just people who live, it's like a family, and they're able to house 2 or 3 patients that they care for 24/7, because we don't have long-term care facilities here. But I've had the question of these caregivers that they would tell me, well, my patient is a medical patient, but they're in pain, and what do I do? Do I give them medicine or whatever? What can I do, doc? And I was always tell them, you have my backing, give the medicine, because the patient needs the relief for whatever it is. But technically, they could technically get in trouble for doing so because they're not supposed to do so. But in ALFs, in hospitals, in facilities, I have not yet seen it happen, unfortunately. But there's some advocacy starting to happen, and I personally went and I offered to educate nurses, for palliative nurses, for hospice nurses, for people like that nobody would, take the offer. So
I've been a nurse at Straub for so many years. They're oncology certified nurse there, home hospice and everything. And yeah, they don't want. Nobody wants the information.
It's unfortunately.
It's sad. It's sad for all of us because we're all going to be there. So widows are advocating now for ourselves when we're in care homes. Hopefully not, and hopefully we are at home. Then it's going to be very hard to get the medicine that we need. And
Correct.
that we want.
Correct.
I have one more question.
Sure.
So I read that the cannabis, that it was decriminalized by the federal government. Is that the same?
I haven't heard that it's been decriminalized. It's there's a specific amount. Besides, by the way, medical. I'm a cannabis advocate, and I always am involved in the legislative session. But when it comes to cannabis. Sorry, what was your question again? Decriminalizing. So it was actually decriminalized a couple of years ago here, the amount that if you're carrying less than an eighth, it's just a fine of, I think, $100 or $200, but it doesn't go on your record. But the federal government, in the eyes of the federal government, as far as I know, as of last night, it's still federally illegal. There were talks recently that was to reclassify cannabis, basically. Right now, like the DEA classifies, there's different classes of drugs, 5. Class 1 is where cannabis sits. It means that it has 0 therapeutic value, which we all know that's not right. And the previous administration, they said we need more research. There was supposed to be a DEA hearing, that was supposed to happen, but it got postponing. Unfortunately, politics is also playing a big role in that. And I don't think with the current administration we're going to see any legalization soon, unfortunately. I doubt it. Because in Idaho, they reversed their medical patients program. In Florida, they're trying to repeal it again, make it illegal. So I don't know what's happening.
Just a quick comment on that. Somehow or another, I ended up on a website called Marijuana Moment, and it's every day they send us emails about all the legislation that's happening all around the country, and I found that quite interesting to understand a little bit more about what's happening.
Yeah, it's interesting. Sometimes Marijuana Moment doesn't get the stuff right, because they were just talking about like sweeping whatever, here in Hawaii. And I was like, wait a second, you guys are. It's just putting catchy titles, We're still in that. But it's a Marijuana Moment. It's a good website to follow because they do keep up with all the legislative stuff that are going on, not just for different for your state, but just for in general, federal. So, any other questions? Well, thank you all for being here. I really appreciate it. If you have any questions or want to be my patient, I'll leave some cards here, and I love talking cannabis, so come talk to me. Thank you all.